Hey guys, it's Rusaal here from Priceline Pharmacy West Brunswick. We're back again with another video just explaining the whole iron testing service that we have and a few products on that we'll be just discussing in terms of what to do if you find that your iron levels are low. So when it comes to iron, a lot of people tend to feel like they have very little energy. They feel like they get very tired very easily, sleepy, they feel cold really easily. So these kinds of symptoms will indicate to us whether or not you may have a potential iron deficiency. And it can be done through a very simple screening test that we provide for $5, and it's an instantaneous result, so then we can help get you to better iron levels sooner. So the idea is we just give ourselves a simple prick and we measure it using this machine here. So I'm going to do it in front of you right now. So we'll just do a simple prick on the finger and grab a little drop of blood. And then we pop it into our machine. So our iron levels are 12.9. So if our iron levels were slightly lower, we'd have many different options in terms of what to do next. So we've got a few different kinds of supplements, and I'm just going to be discussing what kind of things we may need to consider when we are picking an iron supplement. So it's really important that first you discuss the results with your doctor as well, and we often refer you back. And the reason for that is often people with low iron levels may also be low in vitamin B12, and then that would need to be tested as well. So when it comes to supplementing our iron levels, there's many different forms and kinds that you can take. The most important thing is to know, find out what works for you and consulting a pharmacist at the same time. So one recommendation that I would definitely make in terms of selecting an iron supplement is getting an iron in a chelate form. So what that means is that the body recognizes the iron as a bigger compound and it passes it through a bigger channel. So then there's less iron sitting on the top of our gut, and then that stops any sort of side effects. So that's why we often have patients complaining of gas, any sort of constipation, or even diarrhea in some stages. It's because the iron isn't being well absorbed and it's causing irritation to our gut. So that's one thing. The other thing that I would also recommend is to really consider having an iron supplement with some sort of vitamin C or vitamin B with it. And the reason for that is vitamin C boosts up our energy anyway, so do vitamin Bs. But also, these two vitamins help facilitate the absorption of the iron into our system. So it may be that we are getting enough iron in our diet or through a supplement, but it may not be picked up and put into the bloodstream as well. So that is why we always recommend that you have some sort of B vitamin or vitamin C supplement available. You can get iron in a tablet form, in a liquid form as well. Most important thing is just be aware of the liquid forms. It can be really good when you're trying to give children iron supplements, and it's easy to drink and it's often well flavored, but sometimes what happens is it can stain children's teeth. So just be aware of that and make sure that you're brushing children's teeth or your own teeth if you're going to use an iron liquid when you are taking an iron supplement. We always recommend that you do an iron test every 3 months or so, just to see whether or not your levels are well within range and whether or not your medication is working for you. But if you want to come in and speak to us more about how to test your iron levels or getting an iron level done, please come in and see the pharmacist at Priceline Pharmacy West Brunswick, and we'll help you out. Thanks.